introduction. And yeah, look forward to hearing your questions and comments and a discussion. So my brief is to talk to you about the role of exercise on health over the lifespan. So I think that's really important to bear in mind. And I do have a declared interest that, as mentioned, I have a particular interest in dance. I've been dancing since a youngster, and frankly, all forms of movement. Me personally, I love it. And it kind of runs in our family. This picture just shows you that that's my grandmother when she was about in her early 20s, and that's me 2 generations later, carrying on the family tradition of dancing. But this picture also illustrates that we are asking more of our bodies in terms of exercise performance, I suppose you would say. Just within our family, there's, you can see in dancing terms, there's increased demand on the body. So we have to bear that in mind. Of course, we want to encourage that, but we have to match that with, sufficient nutrition and rest, as I will describe shortly, to support hormone health overall. And I want to just at this point point out that 2000 years ago, Hippocrates said this, which I think is as relevant today as it was 2000 years ago. He said that if we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found safest, and I would add the surest way to health. So based on that, that's how I want to approach what I want to discuss with you right now. So I'm going to give you a little bit of background about hormones, why, in my opinion, hormones are crucial, that we talk about them, and how we can harness them through our lifestyle choices of nutrition and exercise. A little word about maybe if we don't get that balance right in terms of our behaviors, relative energy deficiency in sport, as mentioned. Also to bear in mind that our hormones themselves are changing over the lifespan. So that means we will have to adapt what we do. And just a few words about HRT. So hormones. Hormones, I'm sure you'll all be aware, if you look at a standard definition of what a hormone is, it's an internal chemical messenger that's transported in the bloodstream. But that doesn't really tell you what a hormone does. But the derivation from ancient Greek of the word hormone does give you that clue. It means setting in motion. And this precisely describes the mechanism of action of a hormone. When the hormone arrives at a cell, it goes into the DNA and it drives the expression of DNA in producing particular proteins at particular times. So in this way, hormones bring your DNA to life, literally. And so they're key determinants of all aspects of our health, both physical and mental health. Now, the good news is that you can harness your hormones and therefore direct the expression of your DNA through your choices, your lifestyle behaviors. And I've narrowed it down to these 3. We've already had Hippocrates mentioning 2 of them, nutrition and exercise. I'm also going to add in there recovery and sleep, because this really explains why Hippocrates was correct in his statement, because if we can get the right balance of our behaviors, then we will harness hormones to set us on a good path towards optimal health and performance. So that's what we all, of course, want to achieve. Specifically focusing in on exercise, I think we should flip rather than talking about chronic disease, actually, let's talk about chronic health. That's what we really want to be focusing on, chronic health. We want to be healthy longevity. And so this really makes the distinction between being reactive to a disease progression and proactive. We can be proactive, especially in terms of exercise. Then actually this is setting us on this surest path to health. And we've got lots of evidence that exercise is this really fundamental tool we have at our disposal. Here I quote some papers showing that exercise is indeed preventative medicine in terms of reducing the risk of cardiometabolic disease, cancer, and supporting weight control. How much exercise? And actually, it's very straightforward. There is a straightforward dose-response curve. So someone that is very sedentary, just getting them moving, increasing their exercise, their activity levels, that's going to make a massive difference. And also to bear in mind when we're talking about exercise activity, to bear in mind there are various components of fitness that I've outlined here. There's cardiovascular fitness, transporting the effective transport of the blood through the cardiovascular system and the efficiency of the heart pumping, obviously. Muscular strength and endurance, two important elements of fitness there. Flexibility and neuromuscular controls, motor controls, which are important throughout the life, but I would argue particularly in the younger years, and also as we get a little bit older when the balance maybe is not so good. So how can we, bearing in mind all those aspects, exercise activity is super important for our long-term health, and that we want to cover off these components of fitness. What are the recommendations? So cardiovascular exercise, I think we're all familiar with that, but I want to highlight, as I have here, that strength exercise is also now included for all age groups. So that's really important, and great to see that that's been added. And also, this is on the background of overall sedentary time. We know that it's great to do exercise and be active, but if you're sitting at your desk all day or minimal activity, then actually that's not good. So also encouraging people generally to be active and getting up and moving around during the day, that's also really important. And by the way, going back to hormones, to remind you that if we can be active and do exercise to cover off these elements of fitness, then it will be the hormones that will drive the positive adaptations to movement. And you can see here, I've just outlined some, obviously not all, but notice again that there are physical aspects of health, bone health, muscular strength and endurance that I mentioned, body composition, but also for mental health. We know cognitive function and mood psychology, that's also is benefited from partaking in exercise with good effects, positive effects driven by the hormones. So the other component, so exercise, we know that's going to be the centerpiece, but I also, and I see you're excellent, you're having another webinar in due course about sleep, but just so I won't steal all the good news about sleep, but just to highlight here that sleep is, as Macbeth said in Shakespeare's play, sleep is the chief nourisher in life's great feast. And it is actually when you're asleep that you get fitter, because this is the key time when hormones are released overnight. For example, growth hormone, which is an important determinant of body composition. And we know that if you don't have good sleep patterns, then you run the risk of circadian misalignment. And we know that this is a big risk factor for developing metabolic syndrome. So sleep is very important. Also, sleep is very important, as I've outlined here, for the regulation of appetite hormones. So we can't just say, oh, you've just got to do a lot of exercise. We have to balance that with sufficient rest and recovery, and particularly sleep. And sleep hygiene strategies can be really helpful in this regard, ensuring good quality and quantity of sleep. What about nutrition? So this is another important component to support the exercise and the sleep. So the terminology that I often use is that of fueling for the work required on a forward-looking schedule. So fueling for the work required is obviously for you as an individual, how much exercise are you doing? And also on the background energy demand. Obviously, youngsters who are growing and studying, the brain, after all, takes 20% of energy intake. Youngsters, obviously, we have to be aware that they will have a high resting energy demand. And so that's the fueling for the work required for you as an individual, what's needed for you, your personal activity, your body composition, your sex, your age, etc., on a forward-looking schedule. And I think this is really important to stress, that this is a sort of an outline for someone who is active and doing training, doing exercise. So actually, the important point is that the fueling for the work required starts here, the evening before. What you eat for dinner is setting you up already for the next day. because overnight, of course, glycogen stores will be replenished, muscle repair and recovery that will be occurring. And then when you wake up the next day, you're going to be eating breakfast, you're going to break your fast, particularly including complex carbohydrates. If you're going to then go on and do some exercises, it said here, this individual is going to do a race or some really quality training, might need to top up with energy, glucose levels as they're going, if it's activity for over an hour. And then on completion, this is another area that people maybe slip up on. If you've done some really good quality exercise, it's really important to refuel within that 20 minutes of stopping with a mixture of complex carbs and protein, roughly in the ratio 3:1. And that's been shown in studies by Louise Burke and others that if you don't do that refueling with the 20 minutes, that can really disrupt those hormone adaptations that you're looking to achieve. And then when you come to dinner, this is not anything to do with recovery. This is, remember, setting you up for the next day. And what you have for dinner, bearing in mind what your requirements will be for the next day, and that's really helpful. So exercise absolutely is fundamental to driving these positive adaptations of the hormones, but also it's got to be on the backdrop supported by adequate nutrition and recovery and rest. So that's the ideal, the sort of the template for what one's trying to achieve, but you know, it can be tricky. And if specifically focusing in on the energy intake, the nutritional intake, if there is either a surplus energy or a deficiency, this will cause hormone dysregulation or hormonal adaptation, more precisely, which might not be so helpful. And this is where I want to talk a little bit about REDS, relative energy deficiency in sport. So what underpins this is low energy availability, and I will explain that concept using this illustration here. If you look in the central box, you can see that this individual is looking very happy, as they should, because they have got the right balance. They are consuming sufficient energy to cover off their energy demand from exercise, shown in the blue, and then the residual energy, known as energy availability, this is sufficient to cover off all the sort of housekeeping basic demands of staying alive, frankly. Even if we lie in bed all day, we will need a good amount of energy just to support our resting metabolic rate. And also another thing to point out is that movement, the energy demand from movement activity, that is prioritized from an evolution point of view when we had to run away and escape from predators. So this individual here is great. They've got the right balance. They are indeed exercising, great, thumbs up, and they're providing sufficient fuel to do so. And so they're going to be very healthy and drive positive endocrine adaptations. Great. What about this individual over here? Not looking so happy because they're out of balance in terms of their energy intake and energy demand. Although they're doing the same amount of energy as they're eating the same amount of food, i.e. energy intake, as their friend here, they're doing much more exercise. And so this means that relatively speaking, they'll be left in low energy availability. This was unintentional. They didn't mean to do this, but this is just a mistake. This is what's happened. This individual, on the other hand, has intentionally restricted what they're eating in the hope and belief that this will confer some sort of performance advantage. And this is typically in individuals participating in exercise or sport that is against gravity. And seeing as we live on Earth, I would like to say that's probably the majority. So we're talking long distance runners, we're talking climbers, we're talking cyclists, road cyclists, especially having to cycle up hills, aesthetic sports and activities, dancing. You've already heard I do a lot of dancing. So this is a situation of intentional low energy availability. But what is the net outcome? What's the problem with being in low energy availability? This talk is about hormones, so this is what happens. If you have this mismatch between your demand from just staying alive and activity, exercise, if there's this mismatch and you end up in low energy availability, there will be a knock-on effect on the endocrine system. The endocrine system will adapt, but not in a very helpful way for your overall health. So basically, all these stress signals from underfueling, low energy availability, they're fed into the hypothalamus, the neuroendocrine gatekeeper. So, for example, I want to highlight here adipose tissue. Who knew adipose tissue is an endocrine gland? It secretes leptin. And when the adipose tissue is used, and leptin levels will be low, and this is fed into the hypothalamus along with other external stressors. And this causes a knock-on effect. The hypothalamus instructs the pituitary gland to save energy quite sensibly. And so, for example, the pituitary gland will downregulate the reproductive axis. In women, this could have an effect on menstrual cycles. In men, this will also have a knock-on effect in terms of low levels of testosterone. And this, in turn, has an adverse effect on bone health, bone mineral density, as you can see there. Interestingly, the body, as I say, quite sensibly adapts by downregulating the metabolic rate. So the thyroid axis will be downregulated. And so this is not helpful or conducive to either health or performance. The one endocrine system that gets upregulated is the release of the stress response hormone cortisol. And by the way, cortisol favors the deposition of fat. So that's not, I mean, which is very sensible, but not helpful for the individual. And so the net result, if there's a chronic situation of low energy availability, then you're going to run into potentially developing this syndrome of Rett's. To stress that we all, make mistakes, or it's not possible to be absolutely perfectly meet your energy demands. There are other things. I'm sure if you've got an overrunning clinic, then you might not fuel, when you're meant to, you won't have your lunch when you're meant to. So you might have a mini energy deficit. So that's okay, just if this happens from time to time. But I'm talking about chronic low energy availability, day after day, month after month. There's a situation of low energy availability. The endocrine system will adapt, as I've shown you in the previous diagram, and this has an adverse effect on both health and performance of the athlete, because after all, hormones drive those positive adaptations to exercise. So this won't be a good situation for the individual, and particularly for the bones, which I've already mentioned, this is a particular concern. This graph shows you the increase in bone mineral density during the teenage years. If we follow this green line for the time being, the big increase with puberty and the reproductive axis starting up to attain peak bone mass early 20s. The bone mineral density should remain relatively stable during adulthood, and then it will decline as we get older, particularly around menopause. But if you're in a situation of low energy availability and all those hormone systems are down-regulated, especially the ones that support bone health, then you can see, especially for youngsters, they're not going to be able to attain their peak bone mass, and this puts them at greater risk of bone stress injuries and indeed fractures. And also in terms of performance, and this is actually a graph I made to show athletes and dancers I'm working with, they may not have had a stress fracture, and frankly, they want to know if they can win the gold medal tomorrow. They're not really interested, no, you might be at risk of bone stress fractures. They just say, okay, fine, but what about my performance? And if I show them this, then this sometimes can help convince them that it's not a good situation to be in Reds and chronic low energy availability, because you will not have those hormones to support those positive adaptations. And so they will never reach their full potential, either in terms of health or indeed performance. So that was an example. So where have we got so far? So far, I've highlighted to you that hormones are key to health and performance, and you can harness hormones through absolutely exercise and movement with supporting balance of nutrition and recovery. If there's an imbalance in these behaviors, you can end up in a situation of Reds. Now moving on to considering over the lifespan, hormones will be changing, so this adds an extra challenge. Now, out of all the hormone systems, I put to you that this is the most beautiful and certainly the most complex hormone choreography of any endocrine system. Of course, it's that of the menstrual cycle. I won't sort of go through every single little detail of this because I'm sure you're familiar, but just to sum up and say there's an interplay with the control hormones released by the pituitary gland, the conductor of the endocrine orchestra, LH and FSH, and then the response hormones from the ovaries, estradiol, most active form of estrogen, and progesterone. And you can see that here in the follicular phase, basically estradiol's ramping up to trigger ovulation, which occurs here, not necessarily mixed cycle, by the way, but occurs here. And then we enter the luteal phase, so called because the remnants of the follicle develops into the corpus luteum. And now we have progesterone as the dominant hormone. So although I've shown you this is the sort of outline choreography, to emphasize that every single woman will be individual in terms of the timing of when these events happen in the menstrual cycle, in terms of the levels of the hormones attained, and crucially, her individual biological response to these hormones. You can have two women with exactly the same level of progesterone in the luteal phase. One woman will say, I feel fine. The other will say, I'm suffering with lots of premenstrual symptoms. So it's very, very individual. And the other thing to say is that these hormones are indeed amazing. And so I would suggest that if as a woman you're ever told you're hormonal, please take that as a compliment because you are being compared to Hormone, the goddess of effort, energy, and action. And these hormones truly are the instigators of this effort, energy, and action because I could have made the whole talk just about the effects of the ovarian hormones on the body. But these are the highlight, the top level ones for you to be aware of. So these hormones are very important for musculoskeletal health. And we have evidence that athletes who have REDS and whose periods have stopped, they've got low levels of these hormones, far greater risk, as I've already mentioned, not only of bone stress injuries, but also of soft tissue injury. These hormones are also super important for cardiometabolic health. And this is why after menopause, when these are at low levels, the main problem, the main condition, a cause of death indeed, in postmenopausal women is cardiovascular disease, not breast cancer, by the way, because these hormones have a positive effect in terms of lipid profile and endothelial reactivity, the artery walls. These hormones are also important for neurological function, not only in terms of mood, but we have a lovely study here from a colleague, Anna Mellin in Denmark, who found that in athletes whose periods have stopped, they have a slower reaction time, lower peak power production. These hormones also important for gastrointestinal function and crucially, as we've been saying all along, in driving the positive adaptive responses to exercise. I want to just mention here that what about hormonal contraception? Often a question I get asked. So rather than the beautiful hormone choreography of the menstrual cycle you saw in the previous slide, this is what the hormones look like on the contraceptive pill. Everything is suppressed. And so just to make clear that the combined contraceptive pill does not regulate periods, it stops them. And this might be really important for some medical conditions like endometriosis that you do want to suppress the hormones, but it's not so helpful, for example, for youngsters who are trying to attain their peak bone mass if you suppress all the hormones. We have an extra challenge in terms of the changes over the lifestyle for women. All of us will start here as children. All the hormones are low: FSH, LH, estradiol, progesterone. We then move to the central panel once menarche is attained, the beautiful hormone choreography I described. It's possible to revert back to these low-level childlike levels through hormonal contraception, it's true, or an imbalance in behaviors like I discussed with REDS. And so there's a situation of FHA, functional hypothalamic amenorrhea. There's also a little diversion possible over here, physiological amenorrhea of pregnancy. Here, there are really high production of both estrogen and progesterone by the placenta. And then ultimately, all women at some point during their life will move over here when the ovaries retire. Menopause I'm talking about. And so at this point, the ovaries retire. Therefore, we have low levels of estrogen and progesterone, but the pituitary gland keeps sending out strong signals in terms of FSH and LH. So that's the characteristic pattern and change over the lifetime of the hormones. And this is a really important group of women to consider. Not only, as I mentioned, all women will experience menopause, but with increased life expectancy, we can probably expect to spend at least a third of our life in this menopausal state. And the consequences of these reduced hormones, ovarian hormones, like I've already mentioned, from a health perspective, will put women at greater risk of cardiovascular disease and osteoporosis, but also it impacts their quality of life. So this is really important event, the female hormone odyssey, in terms not only of the individual woman, but also for society as a whole. And we've certainly got increasing numbers of masters athletes. So again, another important reason to talk about these hormones. Not only are the female hormones changing, but also for both men and women, there's another important anabolic hormone that's declining with age, and that's shown here, growth hormone. Growth hormone, important anabolic hormone in terms of supporting body composition. And so we have to put this on the backdrop that other hormones are also changing. And also for men, just to mention, yes, testosterone does decline in men after the age of 50, but obviously not in such a dramatic way as at menopause in women. So the challenge we face as we get older is that hormones are changing. And this, if we don't do anything about it and just let this happen and not be proactive, then this will lead to decrease in muscle mass and bone mass, like I've mentioned, increase in fat mass. And also generally, this will put us in a situation where we don't feel like we want to exercise. So again, it's going back to this preventive piece for exercise. If you can acknowledge and realize that hormones are changing, so you need to adapt and change your behaviors, including in terms of exercise, then this will, of course, mitigate the potential, sort of decline. And so focusing on this specifically, I've written here menopausal women, but these principles also apply to men as well to a certain extent. We've got good evidence that exercise is really important for not only for combating symptoms. A very interesting study showing that doing regular exercise helps with the occurrence of hot flushes, maybe because it trains the body to get hot, maybe. We're not sure exactly why, but certainly it's helpful. And certainly in the for long-term health, exercise very important to counteract the effects of declining anabolic hormones and decline in bones, bone health. And osteoporosis, after all, is dubbed the silent killer for a reason. It won't kill you outright, but the effects can be really devastating, sadly, as I've seen in my mother, in terms of loss of height, respiratory capacity, etc. And this study I want to highlight to you, if you're not aware of it already, the brilliantly named study, Liftmore study, which the title describes exactly what the study was about. They took menopausal women in their 60s, and they divided them into two groups, and to one group they gave supervised strength training. And not only did this stave off the decline in bone mineral density, but it actually improved bone mineral density and prevented them in losing height. So really significant study and findings from this study there. Cardiometabolic health, also we have evidence that doing exercise helps combat the tendency towards both cardiometabolic effects of declining hormones with menopause, and also another study similarly showing improvements in body composition taking regular exercise. So exercise, as Hippocrates said, is crucial through all stages of our life, but particularly I would argue, menopause offers the opportunity, the time to refresh and review and look again at exercise. Emphasizing again this effect of getting older and hormones changing on bone turnover. You can see here as we get older, men and women, resorption of bone will be favored over formation. And this is what predisposes developing osteoporosis. And for men, these are two studies I conducted in cyclists, actually. And we found that giving cyclists nutritional advice, like I described, sufficient, particularly carbohydrate intake, and loading exercises, multidirectional loading exercise, this was beneficial for bone health and their performance. In contrast, the group who did not have that behavioral intervention, you might be wondering why I put an astronaut here, is because those cyclists actually lost bone mineral density to the same amount commensurate with an astronaut in space over 6 months. So that's pretty shocking. So again, further evidence that exercise is key for supporting our health, particularly bone health in this case. What about nutrition as we get older? We also have to consider that, because that's in harmony with exercise. And again, good evidence showing that increased protein intake will be really helpful. Maybe even up to 40% of total energy intake is suggested here. Timing is crucial. And an interesting study here to highlight to you that taking protein before sleep helps to support muscle health when you're asleep. Although the growth hormone is declined, remember that is when it's released. So if we can help the growth hormone by providing not only an anabolic stimulus during the day of doing strength training, but also providing those building blocks of amino acids before going to bed, that's going to be really beneficial as well. So this is a summary of my top tips, which will be appearing in Mr. Menopause, soon to be published. So the challenge of declining of anabolic hormones is definitely to, in terms of muscle and bone and deposition of fat. But to counterbalance this, the good news is, if we remember Hippocrates, we go back to the exercise, the nutrition, and the sleep, and certainly across all these aspects, strength exercise in particular, or weight training exercise, whatever you want to call it, that's really important. And not skimping too much on carbohydrates, because that's the main food group for providing the fuel to do good quality exercise. Protein, very important. Sleep, as ever. And actually vitamin D also for bone strength. Hopefully throughout your life, you're taking vitamin D supplements, because living in England, sadly, we don't get enough sunlight to provide adequate vitamin D, but definitely, if not already, I always recommend that people take vitamin D supplementation. Such an easy and straightforward thing that we can all do. So how am I doing for time? Not too bad, so good. So I just want to mention a few words about HRT. We do have this situation. So when we get older, and especially for menopausal women, lifestyle is always the fundament that underpins everything, like I've described. The change in hormones mean we have to change and modify, review, refresh, revise our lifestyle, especially the exercise component, also the nutrition. So where's the place of HRT, hormone replacement therapy for women in the menopausal age group? And unfortunately, we have this situation of what I describe as Scylla and Charybdis. I've spoken to you about the female hormone odyssey. And also, I want to highlight that, by the way, Odysseus was guided by Athena, the goddess of wisdom, of course. And one of the challenges that Odysseus faced was trying to navigate between two really perilous situations of Scylla and Charybdis. And sometimes this is what it can feel like as a woman, trying to navigate there are those camps that argue very strongly in favor of HRT, high doses even, and there are those camps that say, no, don't touch it with a barge pole, that's not a good thing. So to put it all in context, it's every woman's individual choice. We must highlight that. But the main indication is for quality of life. So the woman's done everything she can, everything I've described in terms of lifestyle, the strength exercise, eating lots of protein, sufficient carbohydrates to fuel the exercise, taking vitamin D, done everything, but still struggling in terms of quality of life, then definitely this is the main indication for HRT. We also have to bear in mind that HRT does have a beneficial effect on health in the long term, although not the primary indication. It does decrease overall mortality, and particularly in terms of bone health and cardiovascular health, we know that HRT can be helpful. So I think that this comment here from the Vice President, Royal College of Obstetrics Gynecology, that we need to treat women as individuals, not statistics. I mean, that applies throughout your life, but particularly in this situation. So really, to conclude on some positive facts for you, that what I hope I've really emphasized to you is that hormones, we need to talk more and think more about hormones, because they do support our health and our performance. And we can harness our hormones throughout our lifespan, you know, being respectful and bearing in mind hormones change. If we modify our lifestyle choices in accordance with changing hormones, and this is really the foundations. So a social setting, a supportive social setting, is always going to help. But then actually focusing in on the recovery and the nutrition, the quality and the timing of this, like I've described. And then if you have this, then you can perform good quality training, exercise, movement, and that will drive both positive adaptations in terms of attaining optimal health and optimal performance. So looking at it all together, but with those foundations, I think can be really a helpful way to consider it. So those are my references. And yeah, just a quick mention of my books if you want further information, because I realized I had to really speed up there and speak quickly. So I've written a book already about hormones, health and human potential. Some of the graphs I showed you today, they're in the book. And then very exciting, published next month, Myths of Menopause. There's Athena, by the way, the goddess of wisdom, to guide you through menopause and beyond. So thank you for your attention. And yeah, looking forward to your questions and discussion.
Thank you so much, Nicky. It was absolutely fascinating. I was glued throughout, but I also really appreciate you sticking to the time, because I told you everyone would be dying to hear from you, and I was right. But before we dive into the questions, I would just love if you could share a little bit about your experience, you know, working as both a medical doctor, but also you've trained at a really high level within dance, and just kind of maybe some insights from your own career and own personal experiences.
Well, my personal experience, I suppose, is kind of relevant. That we didn't have by the way, REDS is relatively new. It was 2014. And you can see from me, I'm a lot older than when that first came out. So, but I effectively experienced REDS when I was a youngster, because I was very serious about my sport, about my ballet training in particular. So I ran into that problem. Primary amenorrhea, poor bone health, all the things I've described. So it's like been there, done that. Good news is recovered, in terms of hormone health and therefore bone health and everything else. And then also I've been around the block. I've also personally experienced perimenopause, menopause, that bit, and know that this is a really challenging time for women. So personally, I've seen this, but also those insights together, of course, with my medical knowledge, clinical experience, research, then I feel I'm pretty well equipped to support others, either experiencing REDS. And by the way, to emphasize and say that REDS is not confined to elite athletes or elite dancers or anybody. That's really important to say. It can be any exerciser of any level. So if you're thinking, oh, well, this is just something that doesn't apply to me, that's just for these elite guys, actually, it's more likely to be the amateur exerciser. Because if you are elite in, a professional team or ballet company, I'm medical advisor at Scottish Ballet, you're going to have someone like me who's going to be looking and supporting and making sure none of these athletes develop REDS. But actually, it's more likely the amateur, I would argue, who doesn't have those support networks, who can end up in a situation of REDS. So that's one aspect of my work. And then, yes, any sort of endocrine things, but then focus also on that perimenopause, menopause age group, because that's a big time of flux in the hormones. And, there's so much misinformation out there floating around, it's really difficult to distinguish fact from fiction and you know, what's best for you as the individual. So yeah, that's my sort of personal experience of these situations. And I've been, you know, really fortunate working with over the years with lots of amazing people and studies and projects and things like this. So yeah, I feel that that's why I'm always delighted to share my knowledge, my insights to help others, not only for them as an individual, but also for those people that they're helping. So it's like pass on the information, you know?
And you're also developing the UK's first menopause support program through UCL with Professor Joyce Harper and the rest of the team. I think it's called In Tune. How can people who are listening or health professionals listening find out more about that or keep up to date with some of your work?
Yeah, so yeah, it's really exciting what we're doing at UCL. I mean, it's in the, you know, we want to do it like properly. So we're going to do a proper trial, proper funding and everything. So to get there, so it's not going to happen tomorrow, just to say. And the reason, by the way, we called it In Tune is because you can get in tune with your hormones, you see. So that's what the objective for that. But otherwise, if people are interested in, you know, what I'm doing and my work there, then I've got my website, Nicky Keay Fitness. And so that's posts, talks and things I'm doing, blogs, recent publications, all that sort of thing. And then, of course, the books as well. Those give them more details. But yeah, all, you know, support, questions, interests, all like super welcome.
And thank you for mentioning as well that, you know, I think it's important for everyone who's listening to hear that REDS can affect the amateur athletes. So people who might be doing kind of a Barry's boot camp or high intensity classes, maybe 6 days a week. And they may be then going off to the office, but they may also have REDS. And it can also occur in people of different body sizes as well, because I think ballerinas are sort of that obvious example that it can occur in people of all ages and genders, as you mentioned, with the cyclists, the male cyclists being a really common example.
Yeah, that's a good point about the weight. You know, if you have REDS, it doesn't mean you've got an eating disorder. So, of course, you're going to make a note of what the BMI is or what the weight is, but actually, you can have REDS and still be, you know, within apparently a healthy BMI. But the key thing for a woman is, are you having menstrual periods? Yes or no? That's the barometer of internal hormone health. So that's the key one. You know, and ultimately doing a blood test and seeing what those hormones are looking like, that's going to give you, you know, the answer really. But yeah, important to highlight that it can happen to anybody. And also I think it's, you know, the enthusiasm. Sometimes, you know, too enthusiastic in terms of, right, I'm going to do lots of exercise and I'm going to cut out carbs and I'm going to go all, you know, full out. Actually, that's not the best approach. It might give short-term results. You might feel very good, but in the long term, it's not going to be beneficial because it's going to, you know, switch off, down-regulate all those hormones. So you won't get the long-term positive effects that you're looking for.
Very, very good point. Yeah, and just to flag to everyone who's listening, obviously at Plant-Based Health Professionals, since we focus on plant-based diets and if you're fueling on we're taking in a lot of fiber, that can also increase the risk. So we have 2 really good fact sheets, and one which I wrote, so that's a shameless plug, but it's called How to Gain Weight Healthfully, but it's got lots of tips on fueling and the kind of snacks to ensure that you're getting those calorie dense foods in. But we also have our sports nutrition fact sheet. Okay, we have a lot of questions, so it's going to be more quick fire. How long should you leave between eating and cardio exercise? I can't eat breakfast and go for a run an hour later without getting a bad stitch, so I tend to skip it. I hear this a lot from people who don't have time to eat breakfast before they train in the morning, or they don't find that they find that they don't want to.
Yeah, well, I think you do have to eat something, I'm sorry, because fasted training, well, for anybody, but especially women, it's no good. Because the reason is when you wake up, you've got the cortisol awakening response, right? And so your cortisol's already high. And if you go and then exercise, it's going to put it up higher, you see? So that's, and cortisol, I've told you, favors fat deposition. It's not helpful. So I totally understand and realize the challenge though. You know, as a teenager, I was a competitive swimmer. Every morning, every morning I had to be poolside, ready, changed to swim at 6 a.m., right? And so I had to get up at 5:15, so I would have time to have something to eat before I go training. So I do know that it's a challenge, but you do have to work on it and find what works for you, especially if you're not used to doing it. And also, you probably won't. I tell you, I didn't feel hungry at 5:15, I can tell you, but it's just like I had to do it, right? So maybe start really small. Maybe start with some fruit juice or half a banana, just something carbohydrate based to get you to just put something in the tank before you run, okay? Or you exercise in the morning, and then the crucial piece of refueling as soon as you get back within 20 minutes with your breakfast. So I think it's just a case of exploring and finding out what works for you. And it is training the gut and training your mind as well, you know? Like I said, I definitely did not feel like eating anything at 5:15, but you know, it's just like I didn't even think about it. It's just like I'm going to do it, and then we get in the car, we go to the pool, and you know, so I think just
Fasted
find out what
workouts.
works for you.
How about the fasted workouts, but people having a coffee on top? Is that not gonna, even if it's got oat milk or something, is it better to not to do that and to have something?
I'm going to be pretty, and I'm speaking from loads of evidence, by the way, it's not just my opinion. There's lots of evidence to say that fasted training is a no-no. And I'm afraid that coffee, whether it's with or without milk, doesn't count. So specifically, it is complex carbs that you need, because that's what you need for good quality training exercise. But it is a case of trial and error and finding out for you as an individual what you can literally stomach.
Yeah, all really good. So yeah, definitely take heed of that, everyone listening, whether you're a man or a woman.
Mhm.
So what you have a question about men? What is the role of testosterone in older men for improving bone health? Is that an area that you know about, Nikki?
Yes, so the main hormone for bone health is estradiol. In men, you have to convert testosterone to estradiol through aromatization. So that is the role of testosterone, to make estrogen. Then, so you know, this is really the key thing. So then we go back to, okay, so as a man, your testosterone will be declining at 50, therefore your estradiol, therefore your potentially your bone health. Not to the same extent as women, because it doesn't drop as dramatically as at menopause. Nevertheless, from our cycling study, for example, it's going back to all those fundamentals. Fueling for the work required on a forward-looking schedule, don't skimp the carbohydrates, and it is doing also strength training, right? Strength training is really effective. That's an anabolic stimulus, not only for testosterone, for growth hormone. So that's the story for men. Yes. So thank you to estrogen.
Love it. If an athlete has repeated stress fractures, is this
Mhm.
always a REDS issue?
Well, could be. I think it depends where the site is. Well, first of all, of course, mechanical, right? Is there a mechanical reason why they're getting a stress fracture? Is it always in the same place, on the same leg, or whatever? I'm assuming, let's say it's running for example, or dancers indeed, right? So of course you have to look at the external factors, right? All injuries, there's extrinsic and intrinsic factors. So extrinsic factors, of course. Have they got some weird running style? Or is it the surface they're running on, their shoes? So of course we do that. But then if it's now in a high risk area and it's associated with other symptoms suggestive of REDS, then obviously that pushes you over to that conclusion. But if in doubt, you know, take the clinical history, see what's going on. And if in doubt, ultimately for REDS, it's do a blood test, let's see what's going on. And then you can, you know, direct management appropriately.
Great. This question's been upvoted a lot. So I note that you mentioned post-exercise carbohydrate or protein within 20 minutes, but I was under the impression that the idea of a narrow post-exercise anabolic window was debunked. Is there a mixed opinion or any consensus on this?
As far as I'm aware, and I refer you to Louise Burke, Professor Louise Burke in Australia, amazing woman. She's done so much in this field, and she specifically did a study showing that if you don't, well, I mean, 30 minutes, I'll give you that. But I say to people I work with 20 minutes, because then that gives a little bit of slippage time, you see. And she found, surprisingly, that the first system to be adversely affected is bone turnover. Bone turnover markers were adversely affected if you didn't refuel within that time frame of complex carbs and protein in the ratio 3:1. So I stand by the research and Louise Burke. She's the main one. There are others that say this. So I don't think in my understanding, it hasn't been debunked. If anything, it's been reinforced, I would say.
Brilliant, thank you. So hormones and circadian rhythm wise, when is the best time during the day to exercise?
Oh, tricky one. There are, again, I think we should really focus on what's pragmatic and realistic as well. Because some people say, oh, maybe it's not so good in the morning, mainly because of these reasons about you've got to eat something before you go, and maybe your blood sugar isn't so stable then because of cortisol, whatever. There's that argument. And maybe actually you're better performing in the sort of afternoon, evening. And there was a big hoo-ha several Olympics ago when, because of American TV scheduling, they wanted to do all the finals for the swimming in the morning, which all the athletes were saying no. So if you're just going on that, maybe later afternoon. But if you are working, you can't exercise later afternoon, and there aren't lane ropes available at that time. You know what I mean? You have to balance it up. What from a pragmatic point of view, what works for you, and when can you do it? And also there is some individual variation, I think. Personally, I prefer my Saturday morning class, ballet class, to the evening class, because evening I just feel tired. But in the morning,
Exercise.
actually I feel better, I'm fresher. So again, it's your personal. When do you feel best? And when is the class, or when is the time you can exercise? It's that balance of balancing up all those factors.
Totally. Yeah, completely agree. Okay, we have 3 questions. I'll try and get through them, everyone, so that we can answer them. What is the best exercise for perimenopausal women? Is it high intensity training? Is it strength training? Is it yoga? What do you recommend?
Strength training, again, from evidence. So it's not a case of, oh, cardiovascular exercise is bad, should only do strength training. It's not a case. So those elements of fitness I mentioned, cardiovascular, muscular strength, and muscular endurance, flexibility, neuromuscular skills, all of those 5 elements are still valid throughout your life, but it's the emphasis changes, right? So for perimenopause, the emphasis changes more, swings more in favor of doing the strength type exercise. So it's not at the expense, it's not chucking in all cardiovascular exercise, and it's not chucking in, by the way, I love, dancing, and that's sort of neuromuscular skills, I would say. Also strength training, I'm going to argue, but anyway. So strength training is the most beneficial from those studies I flagged up. It's from the terms of metabolic health and long-term health in general, bone health, etc. So that is the ones. But listen, I just do want to say, I took this slide out, but I have to be honest with you, I hate weights. If strength training to you, like me, sends a shiver down your spine, you think, oh my God, she's talking about going to the gym and lifting weights, right? If you really hate that, that's me. Don't worry, there are other ways of doing it, okay? So, there's a study showing that body weight exercise is pretty beneficial. And for my cyclists, I gave them simple exercises, body weight, simple hand weights, exercises they can do at home. So you don't have to have fancy equipment. You don't have to go to the gym. And if you do a really tough yoga session, actually, that's pretty good strength training. I'm a Pilates teacher, and I know you can push yourself. So it is strength training is the bottom line answer, right, to this question. But as I say, again, it's always about what do you, by the way, if you like lifting weights and want to give yourself a challenge, absolutely go for it. I'm not holding you back, but don't feel that that's the only option. It has to be something that you enjoy, because that means you're going to be able to stick to it. There's no point, forcing yourself to do something you really hate doing, because guess what? You just won't be able to. So it's more important to do it on a consistent basis than going to the gym and lifting weights. But if you want to, please do it.
I think, yeah, that's an important point. And sometimes there's also that initial phase where if you're new to it, you may not enjoy it as much first, and with any exercise, I think, and it's that the one that you enjoy most and the one that you can do is still the most important point. So hopefully everyone who's here is just thinking about what's going to help them stay consistent.
Yeah.
How does the relative energy deficit principle work, or deficiency principle work, when the overarching aim is weight loss and exercise is part of that, with perhaps a secondary aim of muscle gain, but overall there's a deliberate aim for a calorie deficit? And I think this is what so many people think about with weight. They're using exercise as part of those weight loss efforts. What are your thoughts on that?
I think the key thing is the degree of energy deficit. The problem is we all like quick fixes. Who doesn't? So we all think loads of exercise, severe calorie restriction, that must be the answer. But it's not. So it's all about consistency, small, little sneaky energy, mini energy, small energy deficit, like that. That is going to bring the long-term benefits. So I think that's where the problem is. People going to extremes. So yes, facts are facts. In order to lose weight, you do need an energy deficit, undisputedly, but very small, not too dramatic. And also, it's not just that, it's the food groups you're eating. If you want to get quality exercise where you are going to improve, your body composition, you've got to fuel that with complex carbs. Simple as that, right? So, yeah, it's just finding the right balance again. It's Hippocrates, but it's mini energy deficits which are the way to go.
Totally. And I think exactly as you said, you're just going to crash and burn out if you're doing those spinning.
Yeah, crash and burn. Yeah.
Having just a banana or something beforehand. Thank you for clarifying what the combined pill does to endogenous hormones. However, if HRT is beneficial to bone health, how does the exogenous hormones in the combined oral contraceptive pill not help women with REDS?
Because they're different hormones. Because the hormones in the contraceptive pill are not molecularly identical to what you produce. It's particularly the progesterone component of the contraceptive pill that suppresses ovulation, right? So that's why the COCP is not bone protective in FHA. And this is why the Endocrine Society says don't give it, and why I got NICE to change their guidelines in 2022. And now if you look at it, it doesn't say give the contraceptive pill in FHA. It says give HRT. Because the difference between the contraceptive pill, so synthetic stuff that suppresses, right, versus HRT, the real stuff, right? If you choose the HRT wisely. So body identical. Estradiol, typically through the skin, transdermal. My athletes prefer gel, or in general, I prefer that. But anyway, it could be a patch if you want. And then combining that ideally with micronized progesterone, body identical progesterone. So the bones say, thank you. Estrogen, hurrah, they love it. But they're not going to recognize the fake stuff in the contraceptive pill. That's the distinction. It's the type of hormone that's in those two things, right? That's really the key thing. But nevertheless, if you are giving HRT to someone with FHA with poor bone health for bone protection, because the Z-score is less than -1 at the lumbar spine, or they've got 2 or more stress fractures, that's the indication, then you do have to tell them that it's not contraceptive, obviously. So, you must say that, right? So I hope that's clarified that point, but thank you for that point. And this is, by the way, the other reason why, perimenopausal or menopausal women, we don't say take the contraceptive pill, we're going to say take HRT, because you want to support the hormones, not suppress them.
Yeah, all such good points. And as you mentioned as well in the webinar, and it is the contraceptive pill has so many benefits beyond just contraception for a lot of people who've got conditions,
Oh, yeah.
Endometriosis.
Oh, absolutely.
Things. And what would you recommend if someone has got those conditions and they are on the contraceptive pill from a young age? Do you recommend that they pay extra attention to lifestyle factors, to the strength training and things from a younger age? What would you recommend in those situations?
Yeah, absolutely. So, I'm not, of course, it's every woman's choice, contraception. And as you say, there are some very important reasons why actually you would be recommending that. But I am concerned that if we give the contraceptive pill or indeed other progestogen-only contraceptions that suppress ovulation to teenagers, that's going to impact their peak bone mass. And there's yellow card warning in the US against the depot injection of the progestogen, right? For this reason, because it impairs the attainment of peak bone mass. And a recent paper out also saying the contraceptive pill, surprise, surprise, same effects, it suppresses ovulation. So I think we just have to be wary of that. It's a nuanced thing. You know, a youngster, do you really want, are there other things? What are you trying to sort out for them, you know? And lots of teenagers, oh, I've got painful, heavy periods, I've got bad skin. It's like, yeah, you're a teenager. And the hormones are changing. So, you know, seeing if there are other methods, but nevertheless, you're absolutely right. If ultimately, you know, this is the best choice for them, then definitely trying to balance that with lifestyle, like you said, the strength training, the nutrition, all those sorts of things will hopefully mitigate those potential adverse effects in terms of bone health.
Mhm. Yeah, okay, fantastic. Thank you so much. And for everyone who's listening, I did launch a quick poll if you haven't answered that already. Loads of really lovely comments. People have said it's fantastic webinar, really, really helpful, really informative. I don't think we've ever covered this topic in at all on this webinar program in the last 4 years. So much overdue. And loads of dietitians and GPs and health professionals listening, including my dad, who's an orthopedic surgeon.
Oh,
So
cool.
picking up some extra knowledge. And to everyone who's watching, you will get the recording if you are a member. It's going to go up in the members area. And just want to say thank you again, Nicky, for sharing your wealth of knowledge with us. And I know that you also had your birthday this week, so belated happy birthday as well. And for sharing your personal experience. It's just so interesting to hear about your career and kind of everything you do for athletes and dancers and ballerinas and things. It's just, yeah, really inspiring. And I'm definitely going to remember the male cyclist and astronaut comparison. That's really stayed with me. So yeah, thanks again.
Thank
And
you so much for inviting me, and thanks everyone for your attention and your really super interesting questions. I love the questions.
questions will be, yeah, thank you everyone. Good night.
Okay, bye.